Hello and welcome to our clinic. Today I will address the frequently asked questions about shoulder hydrodilatation, a special procedure used to treat frozen shoulder. Both of hydrodilatation and steroid injections are recognized treatment options for frozen shoulder. Steroids are powerful anti-inflammatory medications. They work by reducing inflammation in the shoulder joint capsule, which becomes inflamed in a frozen shoulder. The steroid is usually combined with a numbing medication. In hydrodilatation, approximately 20 to 30 milliliters of clean, sterile water, along with the steroids and numbing medicine, are injected into the shoulder joint. This process aims to stretch the inflamed and thickened shoulder joint capsule, enhancing the anti-inflammatory effects of the steroid. Overall, hydrodilatation is increasingly becoming the most used procedure to treat frozen shoulder, particularly during the stiff stage, as the procedure will help stretch the thick and stiff joint capsule and reduce the inflammation. A steroid injection alone can be considered during the initial painful stage when the shoulder movements are still not restricted, aiming to stop or reduce the inflammatory process. Treatment usually starts with physiotherapy, which can be effective alone. In severe cases of frozen shoulder, or in cases where the progress to treatment is suboptimal, a hydrodilatation procedure is usually performed to treat a frozen shoulder. There is a reported success rate of over 70% in improving the movement of the shoulder joint and over 90% in improving the pain. Most patients notice a significant improvement from one injection, followed by a dedicated physiotherapy program to treat frozen shoulder. However, in about 10% of cases, the symptoms of a frozen shoulder are severe, and the patient can notice only partial improvement. This is more commonly seen in diabetic patients. In such cases, a second injection can be considered. However, we always try to avoid a second injection, and routinely, we would not consider a repeat injection until 3 to 4 months from the last one. The injected medicines will be slowly absorbed by the shoulder joint capsule. Sometimes a small volume of the injected fluid may leak outside the joint capsule. This is acceptable as evidence shows that the response from the procedure is similar in both cases. The length of the procedure depends on the difficulty of the case and the doctor's experience. Usually, 30 minutes is a reasonable time for the whole procedure, including explanation to the patient and preparation. The complications are very rare in general. There is a very small risk of infection, less than 1 in 10,000, similar to any other steroid injection. The answer is yes. We can consider repeating the procedure after a few months in the case of a severe frozen shoulder when the response from one procedure is inadequate. It is important to follow the shoulder hydrodistension procedure by a specialist physiotherapy program to enhance the procedure results.